about nuclear medicine. If anyone can't see the PowerPoint, please let me know. But yeah, I think we're going to start now. So first of all, what exactly is nuclear medicine? Nuclear medicine is the practice of using small amounts of radioactive substances in the diagnosis and the treatment of diseases. Has anyone previously come across nuclear medicine? Feel free to put your answers in the chat, just let me know. Yes, someone said yes. I think that's meant to say PET scanner. PET scanner is like a berry meal diagnosing cancer. Yeah, okay, so nice. So people do have some familiarity with this topic. That's good. Treating cancer, etc. Yeah, well done. Okay. So yeah, we're gonna go over nuclear medicine today, and I've got a few little interactive activities as well that we can do to sort of get to grips with this topic. And it's a very expanding area of medicine and sometimes quite controversial. So I think it's a good topic to learn about, especially for aspiring medicine students. Okay, so first of all, these, the left-hand side, what scan is that? Everyone should know immediately. What scan is that? I think someone said the right answer. Yeah, exactly. So you've said X-ray and that's perfect. It is an X-ray scan. And the reason I wanted to show this to you is because X-ray is one of the most common types of scans, but there are also lots of shortfalls to X-rays. So does anyone know what kind of tissue or muscle X-rays can't go through? Or X-rays can't detect? And I've sort of given an idea to, X-rays show bony structures, yes. So basically they don't show soft tissues because they go right through them. And that's the problem. So that means that X-rays aren't very useful in showing sort of soft tissues like muscles, blood vessels, intestines. So if there's any problems in these areas, you can't see these areas. And that's why nuclear imaging is quite useful in these areas. X-rays, as we discussed in the last week's session, passes through soft tissue, such as vessels and muscles. And that's why this is better for bones. However, they can only see soft tissues if a contrast agent is used. Now, rather than using a contrast agent, nuclear imaging is better to see the soft tissue because therefore you can see the soft tissue, the muscles, the blood vessels, and tell if there's any dysfunction in the muscles or blood vessels, and therefore this is used in diagnosis. Sorry, someone has a question. What is contrast agents? A contrast agent is a certain type of agent which is used with the X-ray to try and see softer tissues. So you'll learn more about this, in medical school, but it's just a chemical used to help, a chemical or a substance used to help see things with an X-ray, even though you can't normally see them. So now we're going to talk about radionuclides, and don't worry about the heavy physics of this. That's not what we're talking. The diagram on the right-hand side just shows gamma radiation, but a radionuclide is a radioactive tracer which is absorbed by tissue. Now, these are normally made of elements such as technetium, thallium, gallium, iodine, and xenon. Can anyone see a pattern in these chemicals? Or what these chemicals might be known for? Because they're not, well, iodine and xenon are quite commonly used, but sorry, not even xenon, but iodine is quite commonly used. What do you think there is a link between these chemicals? Isotopes? No, because it's insoluble, unstable nuclei. Yes, so someone got it, unstable nuclei. They're radioactive in some cases, is the important part. They're not very commonly used. I think most of them are radioactive and or sometimes quite dangerous. But the reason is that they help with this radionuclide tracing. And someone said when a neutron hits the nucleus, a chain reaction is produced. I mean, sure, but that's not really what we're talking about here today. When in the body, they release radiation when they've been injected into the body, and that's what a radionuclide does. And this is normally gamma radiation, and this is picked up by a gamma camera. So the areas where the radionuclide collects in greater amounts is called a hotspot, and these areas are shown, more brightly in a gamma camera. But then the areas that do not absorb radionuclides and are bright on the scan image are referred to as cold spots. So a nuclear medicine scan consists of three phases. There's the tracer, which is the radionuclide administration. Then you've got taking images, and then you've got image interpretation. Now, everyone can probably guess that this is normally how scans are done anyways. First, you use the scan, then you take images while the scan's working, and then you try to interpret these images just like an X-ray works. And the administration time between the average time between administration of the tracer and the taking of the images ranges from a few moments to a few days. Time depends on the tissue being examined and the tracer being used. Some scans can be completed in minutes, while others may need the patient to remain for quite a long time over the course of several days. Now, just a bit of trivia, which is, it's a very simple chemistry question, which could be asked in medicine interviews or application questions. Does anyone know what a barium meal is? And why they can be used? So let's try the barium meal first. What is it? And then if anyone can tell me why it is potentially good as a scan. Okay, barium is insoluble. Yeah, so barium ions, but barium ions normally are not insoluble and they're very, very toxic. So why barium is insoluble is not completely correct. Someone said you swallow it. Yes, you do, but what does it show? The patient ingests it so it shows up on the x-rays because it isn't absorbed. Okay, well, we're kind of there. A barium meal is actually made of barium sulfate. Barium sulfate, the chemical as a whole, is an insoluble precipitate. Barium ions themselves are very, very toxic if they are soluble, because barium ions by themselves are soluble. But because as a precipitate, it's not soluble, it does not mix in the blood. And therefore, it helps to show up on scans without being dangerous. Did everyone understand that? If there's anything you need me to clarify, I will do. Please let me know if, just with a simple yes or no in the chat, if that was okay, or if yes. Okay, someone said yes. So I'm going to move on. But if you do need any clarification, please let me know. Okay, and there's a really good website called Hopkins Medicine, and it's got so much information on all these scans, nuclear medicine, and great news sites as well. So please, please, please take a look if you are interested in going into medicine as a career, or if you're already there. It's really, really interesting. So now we're going to look at a bit of sort of a greater variety of scans that can happen. What do you think the functions of these scans are? So you can look at the names. Some of them might be difficult. Some of them might be easier. For example, you can see renal and thyroid scans. It's quite easy to see exactly what those scans might do. Can anyone guess what the others might do? Any ideas? So let's start with renal scans. What might the function of a renal scan be? Sorry, just 2 seconds. Let me get the chat up. Someone said renal scans show kidney function to see if there are tumors or blockages. Good. And any other ideas? Hydronephrosis. Okay, disease. Good, good, good. Okay, so the entire point of a renal scan is, like you said, to see kidney function. And actually, the other idea of a renal scan is to see if there's abnormalities, as someone said, if there's any disease, and also to see the blood flow in the renal artery, in the entire kidney. It's very important that we can see if the blood flow is blocked or if it's working properly. But great ideas. What about thyroid scans? What might thyroid scans be used for? And what problems could happen if the thyroid is underactive or overactive? Any ideas? To check your thyroid gland, check for lumps, to see if the thyroid is enlarged, check to see if they're underactive or overactive. Yes, so it basically just evaluates thyroid function, or to better evaluate a thyroid nodule or mass. So as we, and this information is being taken from the Hopkins Medicine website, which I previously referenced. But, obviously if you've got underactive or overactive thyroid, that can lead to quite a few problems, and obviously you want to see if the thyroid is enlarged or not, because a lump could be cancer, possibly, but even if it's not, you want to make sure you know what's happening. What about bone scans? That's pretty straightforward. Bone scan to check for breaks, fractures, any abnormalities, to see if there are fractures or broken bones. Yes, exactly. Let's think what else could happen on a bone rather than just the physical changes. What else could happen to a bone? Certain bone diseases. Okay, yeah, you're talking of bent or misshapen. Yes, so if there's any arthritic changes in the joints, if there's any degenerative changes, think about also diseases that can happen to the bone cancer. That's what I was getting at. Exactly. So you could check for bone cancer in this case, because obviously the bone makes up your skeleton, and it's very important that your entire skeletal system is working properly. What about gallium scans? Now, obviously, this does not tell you the part of the body which is helpful. So, which is not helpful. So, what does everyone think? Swelling or infection? So, it does help with infection. Actually, you are correct. It does help diagnose infections, and also swelling. Yes, exactly. Inflammation, really well done. And I think someone said tumors, didn't they? Yes, exactly. Really well done. So those are the three major things that the gallium scan checks for. What about the heart scan? Again, this is pretty straightforward. It's got the name of the body part inside the name. Heart checks the blood flow to the heart, blockages. Yeah, so much like the renal scan, it does help to see if there was abnormal blood flow to the heart, and to determine what else could it help, actually, before I give it away. What else could it be used to detect? Any other ideas? Someone said tumors, or maybe the size of the heart. Think about, let's say, a very specific event that could happen to the heart, and you want to take the scan after this event happens. Heart attack, exactly. So if a heart attack has happened, then you can see what damage there has been to the heart, if the muscles changed, if there's abnormal blood flow, and how you can change this problem and how it has affected function. What about brain? What can the brain scan do? Abnormalities, tumors, neurological diseases, illnesses. Someone said tumors. Yeah, so again, the major thing that they do is the blood flow to the brain. Most of these scans are very important in checking if the blood flow to a certain organ is correct, and if there's any blockages or any problems like that. So that's the main function of a brain scan. And lastly, what about the breast scan? Breast scans can check for tumors or cancer. Someone's already said it. Perfect. Yes, exactly. That's the entire point. And you can see why these scans are so important, because the things that they're checking for are so important and so relevant. And not only this, but this can help with prevention or even treatment if someone already has a disease. So really well done. I hope you guys, if you want to take notes, that's fine by me. This will be recorded and sent onto YouTube by the end of the day as well. And you can find it by typing in the medical debate, where all of our previous sessions are as well. Okay, let's think about some considerations for taking scans. So taking off, for taking these scans of people. What considerations would need to be made? Any ideas? If they are invasive, the level of exposure, the age of the patient, benefits outweigh the risk. I mean more about radiation. What could so not just these scans, in other scans as well. So in X-ray, for example, does anyone know what kind of things people have to make sure that people have when they're going undergoing a scan? The question's probably worded really, really badly. Wear lead aprons to prevent gamma rays. Okay, I'm more thinking. Okay, right. Let's give everyone some ideas. Okay, jewelry. Why? Why do you have to take off jewelry? And what effect can this have in certain diseases? Does anyone have sorry, in certain cases? What effect? There's a very specific name of the effect that this can have on an X-ray. Does anyone know the name of that effect? not sure, blocks the scan. It's called the starburst effect. So the starburst effect is some types of metal, they can actually come off on the scan and they produce this sort of light on the scan so you can't see anything, and that can be a problem. So that's why sometimes jewelry is taken off. If a patient is asked to remove clothes, what would they be told to wear? Very simple question. Don't need to overcomplicate it. What do you think? You know, obviously they might be asked to remove clothes if they're not working in the scan. They wear hospital gowns. Perfect, exactly. Why do you connect patients to an ECG? And what is the full form of an ECG, if you know this? To monitor heart rate, exactly. And the entire point of that is to keep monitoring and taking observations to make sure that the patient is okay. When you're taking certain scans, actually, what they do is to inject the radionuclide, they inject it into the blood in the veins intravenously, but then sometimes they also remove a little bit of blood, add nuclide outside, you know, ex vivo, and they add the nuclide outside the body and inject it back in. Why do you think they do that? Any ideas? So why is it injected intravenously as well as outside of the body? So body doesn't see as foreign object and attack it. Kind of. I'm not entirely sure about this, but I think it's because it maximizes the amount of blood that is exposed to this radionuclide, because then if it's inside the blood, it's possible that it might collect in a certain place or not enough blood cells pass it. But if it's outside and if you you know, inject it ex vivo, you can make sure that the blood is mixed. So when you put it back into the vein, there's lots of blood coming into contact with the radionuclide. I'm not entirely sure about that, but I will double check that. But good ideas. Should the patient, yeah, okay, someone's already 2 steps ahead already, but someone said, should the patient should be moving or lying still? They should, of course, be lying still, because that could complicate the scan and make it very difficult to take the scan. Okay, so now we're going to go across 2 ethical concerns which I thought of. Obviously, today's going to be a bit of a shorter session because this is more of a difficult topic to go into without going into very, very difficult physics or very difficult ideas behind the topic. And but we're going to go through some ethical concerns. So, first ethical concern is as follows. A patient asks the doctor why she steps out when the scans are taking, the radio, you know, for example, x-rays are taken, but the patient has to stay in, obviously, for the scan to be taken. If it's so dangerous, surely the patient should also not be exposed to this danger. Explain why the patient's thinking is wrong. Any ideas? Why is the patient's thinking wrong that the doctor was in? Yes, someone's got it, exactly. So 2 people have answered it. One says the doctor works in the department, hence they are exposed to more radiation, whereas the patient is exposed to less radiation. The patient has a low level of exposure only once, a few times, but the doctor would be having many low level exposures which build up and can be dangerous in high amounts. Exactly right. Obviously, a doctor would be doing the scan day in and day out for a number of patients. For this patient, it's their one and only scan. So that level of radiation is much lower and presents a much lower level of risk than what would happen to a doctor than what would happen to a patient who would just be having for a doctor, it's a higher level of risk than what would happen to a patient who would be having that scan done just once, very low risk, and, you know, done and dusted after the one scan. Okay, this one's a bit more difficult. Let's say a nuclear imaging scan, so using radionuclides, nuclides can cause a health problem due to the radiation risk. Who would be to blame if this diagnostic procedure does indeed cause a problem? Is anyone to blame? Now, obviously, you have to realize one of the problems with giving someone something that is potentially radioactive, is that they can have a risk of radiation from that. And obviously, you know, the answer, the hidden question here is it more important to diagnose whatever this patient has properly, even though we're giving them a radioactive risk? Or is it better to just leave the radiation because there's a potential risk of them having that? However, that would mean you don't diagnose the bigger problem at hand. Someone said no one is to blame. Doctors make very careful decisions because they only carry out the scans in a patient's best interests. If benefits are greater than risks. The scan's benefits and the risks will have been discussed by both the doctor and patient beforehand. So even though the doctor has recommended it, the patient will still be fully aware of the problems. That's really good, cogent arguments. Here's my question. What if the problem that they were trying to diagnose turns out to not be a big problem, and the radiation problem that has been caused, which shouldn't happen, obviously, the radiation given is in low doses, but let's say that the radiation they've given has caused a much bigger problem than the problem they were trying to diagnose. Then what? Does the situation change? Do you think it's the same answer? No one is to blame. Okay, so someone said no one is to blame, and the scan's benefits and risks will have been discussed by both the doctor and patient beforehand. So even though the doctor has recommended it, the patient will still be fully aware of the problems. Right, good answer. I think the main thing that we're missing here is consent. So the word consent, if a patient has already consented to something, then there potentially there is no one to blame. And if provided that the doctor is making the decisions based on the four ethical pillars of medicine, beneficence, non-maleficence, justice, and autonomy. If the patient is unhappy, no one is forcing them. Exactly. That's very important. So a doctor is there to give advice, but not coerce or to force the patient onto anything. If they're making the decisions, making sure that they are doing it in the best interest, minimizing the amount of pain or suffering as much as possible, making sure that the patient is making their own decisions and the doctor is just making sure taking their consent and giving them advice, not compelling them to take something. And last of all, if they're doing everything legally, then the decision should be fine. There is no compulsion in the patient having the scan. Exactly, it's up to the patient. The onus is on the patient. Okay, right. Really well done. And we're going to do a quick role-playing idea. So let's pretend I'm a 30-year-old male who requires a scan. Using this PowerPoint and any previous knowledge, inform me of the scan and explain what will happen and why. So just to be clear, I mean a nuclear imaging scan. So if you guys want to do this, can you please put in the chat, I want to do this, and I'll, unmute yourself and then we'll have a go. Any volunteers? I want to so I need to have a diagnostic scan which will require a radionuclide, and I want to know more about this. I want to know why I can't have a regular x-ray, why, think about what we've learned in today's PowerPoint. Why won't an x-ray work? Any ideas? And then obviously this can always help you get some ideas of communication skills, which are very necessary in the medicine field, on how to talk to a patient and how to make sure that they understand everything that they're going through. Any ideas? Anyone want to try? It's fine if you don't want to. The other option is that if you don't want to do that out loud on a microphone, then what you could do is you could try and explain to me how you would go about it. So what would be the first kind of questions you'll be asked to remove any metal and go into the room with the scan, be lying still, and the doctor will wait outside till the scan happens. X-ray doesn't show soft tissue, so this scan is required to help us learn more about your specific condition. There is this risk of low-level exposure, but the benefit of knowing more about your condition outweighs the risk, but it is your choice to go ahead. Yes, that's a really good, concise delivery of the information. How would you approach a question such as, let's say, for example, I asked the barium meal question and I say, why can I've heard barium ions are toxic or radioactive, for example, and they're really bad for you. Are you completely sure that everything will be fine? And how have you made sure, what happens if that causes more radiation than the problem I already have? A lot of thought and consideration has gone into this decision. If you're unhappy with this decision, no one is forcing you. Okay, good. What about the fact that, like I said, let's say a patient is worried that the diagnosis, because the diagnostic technique requires radiation to go into the body, what if they're worried that that will cause a bigger problem than whatever disease we're trying to diagnose? Someone said that explained barium sulfate is an insoluble compound. It's an ionic compound. Now, let's try, really well done for remembering that information, but let's try and just have just in a broader sense, let's say whatever, whatever, in barium sulfate, that would be the best answer. But let's say in the broad sense of things, let's say you have some sort of radioactive compound going into your body, which could cause a certain radioactive risk. For example, one of the scans we mentioned before, and I'm worried that that radiation will be more dangerous than the disease I'm trying to diagnose. What would you say in that scenario? Think about how much radiation is there actually in the scan? What type of dose is it? Is it small? Is it large? Will it be frequent? Risk of radiation from the ingested meal is very low, as it is a small sample that has been tested on humans and only happens once. Yes, so normally the scans are of low radiation risk, and that's how you would explain it. And obviously, if they have any more questions, they're more than welcome to ask another doctor, or you can get them another opinion from your someone who's higher up than you, and you can try and allay their fears. And equally, let's say someone very clearly states no, they don't want a scan. What do you do? Very simple answer. You respect their decision. Exactly. Someone said you respect their decision. If they don't want it, it's completely up to them. You respect their autonomy, yes. And you suggest possible other non-radioactive methods and see what else you could possibly do. Really, really well done, guys. Okay. Sorry, just let me open the chat again. It's gone. Yeah, suggest other pathways. Exactly. Really well done. You don't try and coerce them. You make them, you need to let them, you need to respect their autonomy, make sure that they understand what their decision means, and that's it. You do not coerce them at all. Okay, so thank you very much for listening to today's session on nuclear medicine. I know it was a short one today, but that's because this was although it's an important topic, it is quite small at our level to explain everything. And yeah, thank you very much for coming. This session will be on YouTube by the end of the day or by the end of tomorrow. And if you guys have any questions, please let me know. Please feel free to invite more people to these sessions from next